Climate Week 2024, and good morning. My name is Steve Cremando, Director of Training for the Disaster and Terrorism Branch in the New Jersey Division of Mental Health and Addiction Services in the Department of Human Services. I'll be your moderator for today's discussion. On behalf of the New Jersey Interagency Council on Climate Resilience, or IAC for short, we'd like to thank you for joining us today to learn more about how climate-driven temperature increases and extreme heat events can impact both our physical and behavioral health. The IAC was established by Governor Murphy through Executive Order 89 and consists of 26 state departments and agencies coordinating together at a state level to develop and implement short and long-term actions to address and mitigate climate impacts on New Jersey's economy, communities, infrastructure, and natural resources. Part of the IAC's mission is to educate New Jersey residents about and prepare them for the impacts of climate change and the actions needed to protect New Jerseyans. In recognition of New Jersey Climate Week 2024, we're fortunate to have an introductory message for you from New Jersey's First Lady, Tammy Murphy. Our First Lady is a current Board of Director and charter member of the Al Gore-founded Climate Reality Action Fund and initiated New Jersey's first in the nation K-12 climate change education curriculum requirement.
Hello, New Jersey. I am First Lady Tammy Murphy, and I'm delighted to have the opportunity to address you all during Climate Week 2024. Thank you to the Department of Environmental Protection and the New Jersey Interagency Council on Climate Resilience for hosting today's important webinar. Here in New Jersey, we're working at an incredible pace to make our state more resilient to climate change and to mitigate the impacts already affecting us. The Garden State has the people, the plans, and the power to make a difference. Today's webinar offers the opportunity to address two of my largest policy portfolios at the same time, our climate crisis and our maternal and infant health crisis. I'm really glad to count Department of Environmental Protection as a partner on both fronts. The panel today will focus on the state's rising temperatures and the impact of extreme heat events on the health and well-being of all New Jersey. Global warming is driving climate change and has a significant impact with real-world implications. However, because we are accustomed to warmer days during the summer, it can really be difficult to recognize when temperatures turn deadly. This summer was the third warmest on record since we began tracking in 1895, and June ranked as the second warmest June in New Jersey's entire history. This warming trend is reflected in the fact that 10 of the 15 warmest years in our state have occurred since 2010. Notably, the 10 warmest years on record globally have all occurred in the last decade. The rising temperatures driven by climate change can have serious physical and behavioral health impacts on vulnerable populations, such as the elderly, homeless individuals, and pregnant women and their babies. Notably, high temperatures can increase the risk for premature birth, low birth weight, and even stillbirth. It is my sincere hope that what you learn during today's conversation will help you to make your own households, as well as your neighborhoods and communities, better prepared to deal with this burgeoning matter. Education is the key strategy to addressing our climate crisis, and we are starting early in New Jersey. In 2020, we became the first and sadly still the only state in the nation to integrate climate change across our K-12 learning standards, ensuring that we are preparing our students to become the climate literate leaders in the future green economy. It's really critical to help our fellow New Jerseyans recognize and prepare for the impacts of heat stress to ensure they know which actions to take to protect themselves and their loved ones. So today's webinar is aimed at equipping our residents with this knowledge and complementing information available through Heat Hub NJ. Again, we hope this webinar will inspire you to take action and spread the word. So I really genuinely thank you for joining us and hope you have a great webinar.
This webinar is the second in a series designed to educate the public on extreme heat. The first webinar laid the groundwork for understanding warm weather patterns in New Jersey over time and expectations for that trend moving forward. If you missed that session, the webinar recording is posted on the events page of Heat Hub NJ. Today, we'll dive into ways that these warming weather trends can impact our physical and mental well-being. In this episode, we'll discuss the medical and mental health impacts of extreme heat, specific vulnerabilities of individuals and groups, how the medical system and providers are preparing for extreme heat events, and ideas for protecting yourself, family, and friends from the health impacts of extreme heat. To that end, we're fortunate to have a panel of 4 health experts with a wealth of knowledge on how and why extreme heat impacts need to be taken seriously. I'm going to briefly introduce each of our panelists, but please visit the events page on Heat Hub NJ to review their full bios. First up is Dr. Elizabeth Lisa Chercheo, or Lisa. Lisa is an associate professor of medicine and director of climate health at Cooper Medical School of Rowan University, associate program director of internal medicine residency, and chair of physician engagement and women in medicine. She leads several climate health and public policy committees and consortiums for various associations, including the New Jersey chapter of the American College of Physicians, the Medical Society of New Jersey, and the Medical Society Consortium on Climate and Health. In addition, she's working to integrate climate health throughout medical training at Cooper Medical School of Rowan University and championing healthcare sustainability nationally. Next is Dr. Jean Kraft. Jean practices pediatric critical care medicine at RWJ Barnabas Health and is a clinical associate professor in the Department of Pediatrics at Rutgers, New Jersey Medical School. She also works in the health informatics field, which seeks to leverage information and technology to improve healthcare and advance biomedical research. Jean is a past president of the New Jersey chapter of the American Academy of Pediatrics, a founding member of Clinicians for Climate Action New Jersey, and a member of the Climate Advocates of the American Academy of Pediatrics. Next, Robert Clay, the Vice President and Chief Operating Officer of the Mental Health Association in New Jersey, an organization that strives to ensure that the behavioral health is recognized as a key component of our commitment to public health and climate change. Under his leadership, the association has developed a broad array of nationally recognized peer recovery support training programs, such as Mental Health First Aid and the New Jersey Statewide Call Center. Robert's philosophy is that building community partnerships and collaboration creates strong social justice foundations to address the racial and cultural inequalities and stigma that limit access to behavioral health services and community recovery systems. And finally, Dr. Soto Sitoguchi is a general internist and epidemiologist and professor of medicine at Robert Wood Johnson Medical School and epidemiology at Rutgers School of Public Health. Soko wears a number of hats at Rutgers University, including being the Director of Research Education at RWJMS and co-director of the Master of Science in Clinical and Translational Science at the Rutgers School of Graduate Studies. She leads multiple climate change, health, and healthcare sustainability initiatives at Rutgers Health and is the co-director of Sustainability Committee at RWJ Barnabas Health. Soko pursues her passion for patient care as a hospitalist at Robert Wood Johnson University Hospital and conducts clinical and community relevant research as a clinician scientist. Her research expertise is in environmental health services research and pharmacoepidemiology, studying the health impacts and health services and treatment in patients with chronic conditions and their interaction with environmental and climate-related factors. Thank each of you so much for joining us today. Before we get to our questions, I'd like to lay out a few housekeeping sort of items first. The webinar is being recorded, and the recording will be posted on the events page of Heat Hub NJ in a few days after this event. Audience members are in listen-only mode to cut down on background noise during the discussion. Today's format is interview style, with panelists fielding specific questions followed by a Q&A section from audience members. If you have questions, please jot those down in the chat feature, and we'll do our best to get to them during the Q&A section. So let's get started. First question, Dr. Lisa Chercheo and Dr. Jean Kraft. Why is it important for everyone to understand the hazards associated with extreme heat and to be able to recognize the signs and symptoms of the different heat-related illnesses and how to react to and confronted with those symptoms?
Thank you so much for the question. I'm adult health, so I'm not sure if Dr. Kraft, who treats our little people, wants to go first. I think you're muted.
If you go first, and then I can add the pediatric
Sure.
specific
Oh, absolutely.
modifications.
Absolutely. So there are numerous reasons why we're concerned about this right now. There's a big spectrum of disease. There are certainly mild conditions like heat rash. Sometimes we'll see it when in babies and young children, but we see it in adults as well. It might be a bumpy red rash that might be itchy. It could even be secondarily infected. That's pretty minor. But then as people start to get more dehydrated, you can see things like cramps happening because as you're sweating, you start to lose salt. And so you get electrolyte changes, so you can get cramps. When we start to get worried, though, is when we start entering into heat exhaustion. And I'm sure many of us have experienced this. That's when you get some nausea, maybe some vomiting, headaches, fatigue. Many of us have, I'm sure, experienced this. When you're in heat exhaustion, it's still very reversible. You can get into a cool area, you can hydrate, you can get out of it if it's quickly recognized. Where we start to get really worried as clinicians is when you start to progress. There's something called heat injury, where your core body temperature has not necessarily crossed a critical threshold yet, but you're starting to see actual end organ damage. So you're seeing things like kidney injury. You might start to see your heart being impacted, but your brain is still okay. Where we get really, really nervous is when you start to have changes with your central nervous system. You start to have central nervous system changes like it may just be slurring your speech, or it may be irritability. It may be obtundation. Sometimes people will have seizures, but once you have those brain impacts, then the mortality jumps anywhere from 20 to 80%. And so when you're in that stage, and that can happen very quickly, you can be well hydrated, you can be totally okay, and then go out and maybe you're running a race, or you're out and it's just a really hot day, and maybe you have some underlying health conditions. Within 15 to 20 minutes, you can develop heat stroke. And so that's when we really have to get people into a hospital setting, or have EMS start to do rapid cooling on those individuals. And the rapid cooling can happen in the field. It can be misting people. It can be putting ice packs. Ideally, we like to do it in the groin, the axilla. That's not so comfortable. Sometimes, even just doing it on the palms and the soles and the cheeks can help, but we want to get that body temperature down as quickly as we can to a safe level. And we want to try to rehydrate people as quickly as we can. And the type of hydration is also really important too. So, you don't want to be repleting with coffee, because that's just going to dehydrate you more. You don't want to give people alcohol or even energy drinks, things like that. Really, you want to be rehydrating with water, maybe with some electrolytes. There are commercial sports drinks out there in the acute setting. If it's more of people who are chronically exposed to heat, we have to be careful about some of those sugary drinks, because the sugary drinks can actually, it seems like, worsen kidney damage. So those are just a few with adult medicine. Some of the things we really worry about. And just, for scope, we know that right now in New Jersey, about 445 people are dying of heat-related illness every year. And that's with our current level of warming. So that's expected to increase in the future. So all the more important that we recognize this now, and that we really try to prioritize this as a heat emergency. But Dr. Kraft, I'd love your perspective on children as well.
Sure. So everything that Dr. Chacheo said about adults also applies to children, but there are some developmental and growth differences between adults and children. So, if we look at infants, they have a relatively large amount of skin for their body size. So they will absorb heat quicker. So if you are with an infant and you are starting to feel really hot they got to that point before you did. And they can't tell you that they're feeling warm. They may get a little fussy, they may get a little irritable. And if you add on to their inability to speak to you and their more rapid heating, the fact that sometimes you overdress them for the temperature because you're worried that in as much as they get hot faster, they can also get cold faster. And so sometimes infants are overdressed for the amount of heat. So now they're heating that much faster. In addition, we are not all born great at sweating. And sweating is a key mechanism for getting rid of excess heat. So you have small people not really good at sweating. They generate more heat just because they're growing. They have more skin to absorb external heat, and now maybe they're overdressed. They're going to hit the heat illness points faster than a similarly sized adult. They also can't get themselves to a cooler place. So if an adult is warm and outside, they may look for a tree to shade them. They may look to see where the water is. They may look to seek help, and children are not able to do that. And one of the most tragic examples of that is that every year children are inadvertently left in cars and die as a result of being overheated. And that is partly because cars heat up much faster than we realize. It takes, if it's 72 degrees outside and it's partly cloudy, studies show that within an hour, you are at a lethal level of heat in that car. And so cars heat up very fast, and children, they can't get out. Which is the other problem with that. If you are sitting in a car waiting for somebody and it starts to get hot in the car, you're going to roll down a window, open the door, get out. Kids can't do that. So as they grow, they approach the adult ability to do things like sweat, do things like take off extra clothes, that jacket that they don't need. They get better at getting out of a hot environment into a cooler environment. They get better at asking for help. They get better at telling people they're hot. Now, there are windows in normal development where the desire to not appear weak in front of your peers overcomes your willingness to say, I'm hot, I'm tired. I know that I'm at practice for football, but I really need to take a break. And so it's important that the adults who aren't worried so much about peer pressure, who aren't worried about somebody telling them, no, you can do it, help to see when somebody does need to take a break and step away from the heat, get into the shade. So, so that is sort of the pediatric flavor of all of the information that was presented by Dr. Chucheo.
And that's all so helpful. I mean, so many aspects I don't think we normally think about. I want to shift directions, though. Dr. Soko Sitaguchi, humidity. New Jersey's summers often combine high heat with high humidity, resulting in higher temperature or higher heat indices, which approximate the temperature feel to how it feels with our body. How does humidity factor into how our bodies respond to high temperatures?
Sure, thank you for the question. So New Jersey heat index, which is the incorporation of temperature and then the humidity, is relatively high, especially in the southern and then coastal regions in the New Jersey, similar to Midwest in a sense. So high humidity reduces sweat evaporations, making it harder for the body to cool down, which is a compensatory mechanisms when the body is facing heat stress. So that's why it feels, even with a lower temperature, with a high humidity, it feels hotter to the body. And then because of that, and then the sort of, difficult to sweat it to evaporate, I increase the risk of heat-related illnesses such as heat exhaustion, heat strokes, that has been mentioned by Dr. Chucheo.
Great, thank you. Now, just changing direction a little bit about populations, Dr. Kraft and Mr. Clay, who's at the greatest risk for experiencing adverse physical health impacts for high heat? And then the same question, what population are at the greater risks for the behavioral health impacts of high heat?
So I talked about kids as being particularly vulnerable, but some of their vulnerabilities translate to older populations. There are adults who have the same inability to move to a cooler place. There are adults who have the same inability to express that they are feeling very thirsty and very hot. Athletes are often feel compelled to compete to the point where they fall down, which is way too long. And I think it behooves all of us to help these young athletes and even older athletes speak up when you need a break, and also observe and feel free to suggest that somebody take a break when it looks like they need them. And then, the behavioral health community, and I'll just say this very briefly and then turn it over. So there are issues not only with anxiety, agitation, sort of an increased unpleasant response to heat that certainly impacts behavioral health, but a lot of the medications that help you stay safe and well also predispose you to adverse effects. I'm going to go ahead and turn it over to my partner now.
No, absolutely. I think it's you're going to have a lot of folks who have mental health issues. Obviously, are on different kinds of medications to control that aspect of it, and heat impacts on that. Same with substance use medications as well too. It also, exacerbates a lot of pre-existing conditions. A lot of folks that have chronic mental health issues also have chronic other health issues as well too. So you're building one issue on another. The other aspect too is that folks that have more chronic mental health issues are also impacted by the social determinants of health, which is, low income, poor housing situations. Many elderly that we don't really deal with very well. All these combine to really put a great number of people at risk to heat-related issues. I think that's something that also with folks with mental illness or those kind of impacting with that, they're more likely to isolate themselves. And when you're isolating yourselves and not part of a community, you don't have the opportunity to take use of cooling centers and other opportunities to deal with the heat issues.
Let's stay with both of you, Gene and Bob, for a moment and ask, what kind of short-term physical and behavioral impacts does heat have on the body and the mind? At what point does the body and the mind start to become incapable of compensating for increasing temperatures? Is there sort of a tipping point, or what do we see physiologically and psychologically or psychiatrically?
I think at least psychiatrically, or you see things like a sort of kind of a lack of awareness. That again, as we mentioned before, the lack of awareness of what their body temperatures are. Much more increased stress and anxiety and confusion. Medications also themselves are, whether they're altered by heat and moisture, so that changes their level of effectiveness and their potency. And side effects can be also amplified. Tardive dyskinesia is something that can get, as example for folks with schizophrenia, can get more involved and more intense. So I think the heat just intensifies the symptoms.
Gene?
Yeah, I would agree with that 100%. I do want to make one comment about pregnancy and heat. Just that the heat-related illness in pregnancy affects not only mom, but the fetus. So that it really is a much bigger deal that sometimes we don't necessarily recognize until a baby is born, and they're born a little too small. There's some suggestion that there may also be birth defects associated with heat exposure in pregnancy, depending on where you are in pregnancy. So it's sort of a twofer on that. And then the other thing I'd like to say about this is that, as we go through heat-related illness, it is incredibly important to recognize it before your own body is unable to protect you. So as you move, for instance, from heat exhaustion to heat stroke, you actually lose the mechanism that makes you sweat. You actually are less able to regionally control temperature and blood flow to help to get rid of the extra heat. So your own body's compensation for you lose thirst. You are no longer thirsty. So that everything that your body is doing to try to get you to a safer, cooler, and often more hydrated space begins to fail you. And that's when you get the damage to your kidneys, you get damage to your heart, you get damage to muscles, you get other damage in your body. So early recognition, having somebody sit down in the shade with something to drink is a much better solution than having to call EMS. They go to the emergency room or admitted to an ICU, and you don't know if they are going to fully recover or not. So early recognition, and the very earliest recognition is, if you have a weather app on your phone, checking what the high temperature is going to be today. And you know what, if you're maybe you're a trainer, saying, we're going to shift our outpatient practice to inpatient. Being aware that there's a possibility that it could be too hot to do whatever you had planned is the first step in preventing heat injury. And actually, for training season starts in the summer for a lot of fall sports. So it's starting when it's super hot. There are actually demonstrated approaches to gradually allowing people to acclimate to the heat. So if you have small exposures over a long period of time, in the end, you're going to be able to tolerate the higher heat a little better than you have if you have a long, strenuous exposure as your first exposure. You are going to go through the phases of heat injury much quicker than if you allow time to acclimate to the increasing heat.
Now, on that same theme, there may be people who have pre-existing conditions who need to be even more aware, to your point, Jean. So I want to shift the question to Soko and Bob. In the physical and also the mental health domain, are there pre-existing physical and behavioral health conditions that would make someone more susceptible to experiencing adverse physical or behavioral health impacts from high heat?
Well, I think
Can
some
I
of
go
the
first? Oh, go ahead.
absolutely, Soko, go.
No, you can go. Now you start.
We're equally. Just real quickly, I think we talked a bit about people that are on different kinds of psychotropic medications for mental health and addiction. Those increases opportunities. Some of the data shows too how difficult this is. There's in some of the things that behavioral health emergency rates, for example, are much higher in heat situations. Some of the data has shown where people that are normally just affected by anxiety and stress-related issues, mood disorders, disillusional disorders, and substance use and self-harm, all those issues are amplified during heat. So I think if you have those situations, you may not think you may be dealing with an issue. The heat situation is going to amplify that out. And it also, if someone has had traumatic incidences in their lives associated with some kind of climate issue, been involved with a hurricane or some kind of flooding issue, for example, those issues are there, and a lot of times that's connected to heat and weather-related things as well too. It can create and exacerbates people's trauma in their lives.
Okay, so I'm going to maybe focus on the physical aspect of it and the chronic disease conditions. So as you've already heard about the danger of heat exposure on heat-related illnesses such as heat stroke, heat exhaustion, heat syncope, it's actually is a tip of the iceberg. The heat can also cause exacerbation of underlying conditions such as cardiovascular disease, chronic respiratory disease, diabetes, kidney issues. So those people with such sort of conditions, cardiovascular disease such as coronary artery disease or heart failure, asthma, COPD, diabetes, we talked about chronic kidney disease. Those people are at risk of not only to the heat-related illnesses that we just heard about, but their exacerbation of their underlying conditions as well. Other people, I guess, conditions that we should probably touch on is the obesity and then aging itself, right? The obesity makes you intolerant to heat in general. And then those people tend to have already cardiometabolic conditions as well. So put them at the risk, higher risk. And then, of course, the aging itself reduces the coping mechanisms that the body has to the heat stresses. So put them at the higher risk, of course. And then with the dementia, could sort of change behavioral sort of patterns, and then, they may not recognize the danger and then put them at the higher risk as well.
Soko, Bob started to mention before some of the psychiatric or psychotropic medications that had risks. Are there other medications in terms of physical medicine rather than behavioral medicine that put people at risk, or medications that become less effective in high heat conditions from a medical standpoint?
Yeah, thank you for the question. So this is actually one of my research areas that I study the medications and environmental interactions. I'd like to urge people to actually go to there's a very, very nice website that summarizes this sort of issue put by CDC. They talk about the heat and medications. So and sort of to summarize how the heat and medication can interact, there are three ways. One is what Bob is already talking about, certain medications, or their medication side effect could be exacerbated by the heat. There's a medication, what we call medication heat interaction. Another way is that the medication heat can directly affect how the medication works. I think Bob already mentioned that as well. But then the famous one is actually instant, because it has to be kept in a very cool, in a fridge. And then when it's left outside, when it's hot, or when you lose actually electricity from the storm, and then the heat happens, this drug could become ineffective. And then the other sort of issue between the but the sunlight and then the medication is that when you have a topical medication put on your skin, such as antifungals or antibiotics, that could interact with the heat and then increase the skin sensitivities as well. So in terms of the medication skin, I guess, heat interaction that we were talking about, in addition to what Bob mentioned, which is antipsychotic medications, other medications that are listed, there's a very nice table on the CDC website, include cardiovascular medications such as diuretics, antihypertensives such as angiotensin receptor blockers, or beta blockers. And then there's other psychotropic medications include SSRI, SNRIs, like antidepressants. These are antidepressants. And then stimulants for children is, especially for ADHD in children, is something that we also have to be careful about.
Great, thank you so much. Lisa, a two-part question for you. Are there long-term chronic conditions that come from repeated exposure to high ambient temperatures? And part of that is kind of building on that, social determinants of health, such as race, ethnicity, income level, employment, et cetera, that again influence how susceptible someone may be to experiencing adverse, both physical or behavioral impacts from high heat.
Yeah, thank you. It's such an important question. And Soko already touched on the tip of the iceberg, like no pun intended here, but it really is when you see that the number of admissions that are coming into the hospital, or that the EMTs are getting called out to, a lot of those chronic conditions, like particularly respiratory conditions, and that might be a marker of frailty as well, but everything from, sepsis being worsened or being increased, from cardiovascular disease, even inflammatory bowel disease and GI conditions. So there are a lot of chronic conditions that can be worsened, but we're getting more and more research now that there are conditions that can evolve just on its own, particularly kidney disease. And some of this research actually started in Central America because we were seeing that sugarcane workers were out in the field. There's no worker protections, out in the field for 10, 12 hours a day in blazing heat with no hydration. And every day they would come back and they would be talking about urinating sand. And they were actually urinating out urate crystals, so like stone crystals. And they would check their kidney numbers and they would gradually increase. And then the next day it would come down and then it would increase again and it would come down until it stops coming down. And then it just gradually increases. And so we had called that Mesoamerican nephropathy, but now we know it's not just in Central America. It's been identified all over the world. And so that heat exposure in and of itself, especially when you're not rehydrating in the moment, is an enormous risk factor. And we know that kidney stones also go up, because as you become dehydrated, you have a higher concentration of calcium and oxalate and urate, all the things that are stone formers. And so we've seen, particularly in hot climates, but all the way up here as well, that there's been an increase in kidney stones. We've even seen changes in the gut microbiome, and there's some really fascinating research coming out of Arizona, where they're really the epicenter of a lot of the really severe heat impacts. And the gut microbiome even begins to change, and it begins to resemble gut bacteria that's seen in depression and anxiety and other chronic conditions. So I think we're really just starting to understand the depth and the breadth of the heat impacts because the research is evolving. And then your second question was about the social determinants of health, which really goes into it because, those people who are going to be exposed to heat for long periods of time are probably those that don't have the agency to speak up and say, I don't have the right kind of worker conditions. So the social determinants of health really, I think, have come to the fore in medicine, because we now recognize that if you're unhoused, you're not going to be able to take care of yourself. If you don't have regular transportation, you can't get to your doctor's appointments. And that extends to the environmental determinants of health. So if you think about things like urban heat islands, that's an enormous risk factor for people because all of that asphalt just holds on and amplifies the heat. And a big problem is that at nighttime, those temperatures don't cool down. So your body doesn't have any respite. It can't deactivate those stress hormones that are ramping up. And so a lot of times when there's a heat wave, we might not see the admissions coming the first day, but by the second and third day, those effects start to really build up. And so you see those cumulative impacts. And we know when heat waves are coming that there's about an 8% or so increase in hospitalizations. And many are coming from our most vulnerable populations that everyone else on the call had mentioned. The other thing to consider too is that with the ecological or environmental determinants of health is that people aren't just exposed to one thing. So it's usually not just heat. They may also be exposed to air pollution. They may also be exposed to other issues. So it's really important to take those risk factors in their totality when we're assessing patients.
Now, we have had some great discussions so far, but I also want to be sensitive to our time because I want to get some questions in from our audience. So what I'd like to do is for the next 5 minutes, a little bit of a speed round of questions. So I have some specific questions for our panel. I'm going to ask you to keep the responses real tight so we can get those important answers from our audience. The first of these speed round questions for you, Bob, we're going to talk about the role of heat in increasing potential aggression and that sort of behavior, aggression and violence. What is the relationship, if you could summarize that we know?
It does. Yes, I think the best of the answer too. It increases things like suicide rates, anxiety, stressors, all the things that we have talked about here, and create social situations. Again, as you talked about being in an urban heat environment at evenings with people out, it increases people together in stressful situations who may or may not be able to handle those stressful situations because of mental health issues and social situations. So I think we've seen that pretty obvious in our communities today.
So we're seeing this wide range of impacts. Soko, a question for you quickly, the role of ozone as it forms in the presence of heat and sunlight. What's the comorbidity in different vulnerable populations when we bring ozone, heat, air pollution, et cetera, into the mix simultaneously? How does that change the equation?
Sure. This is heat, but also PM 2.5 does too. These two major air pollutants are associated with cardiovascular risks and then worsening of the lung events. So two together with the heat, and the heat itself is also associated with those cardiovascular events and then the lung respiratory events. So two.
Okay, Soko, you froze up a little bit. Oh, there you are. Sorry about that. Okay.
Oh, sorry.
Last of our speed round questions for Jean and Lisa. Your perspective, are healthcare providers adequately trained and equipped in terms of having the knowledge and resources they need to recognize and address the physical and psychological impacts of extreme heat? How are we tracking the extreme heat effects on human health to better understand it? Where are we in terms of preparedness across our healthcare system? That's our last speed round question, and I want to hear from the audience.
So can I just jump in on the information side of this? There's a lot of work being done across the country that is using data that hasn't necessarily been incorporated into health records and healthcare system records in new and interesting ways. And so, for instance, here in New Jersey, the Rutgers Climate Science team, and I say team because it spreads out over multiple departments at Rutgers, they are looking to combine heat data with development data, with transportation data, with water, flooding, et cetera data, with health data to better use all of the information we have to predict when there's going to be a problem. And one way that this worked very well was in New York City when they had a plan for implementing, activating cooling centers, sending out public health notices with heat warnings that had a threshold that was actually 2 or 3 degrees higher than when people were actually seeking health related or heat-related injury treatment. So they combined health system data so when are people coming to the emergency department with heat, and it's actually below where you're telling people that there could be a problem. So New York actually decreased their threshold for making the announcements, and I think that in New Jersey, I think we're very fortunate to have the Rutgers team really looking at combining this kind of information so that we can better take care of people. I'll turn it back to you, Elizabeth or Lisa.
Thanks. Yeah, actually, just to dovetail with that, our electronic medical records are another source that are close to home for a lot of us. Most hospitals will have electronic medical records, and a lot of them you can enter in the social determinants of health, things like food insecurity and housing insecurity. We need to get into the habit of entering things like the environmental determinants of health as well, so that we can preempt some of the vulnerable patients and really do outreach to try to protect them more. There's a big question to end with. I want to address the preparedness of us. So there are increasingly integration of climate health throughout the medical education continuum, from our undergraduates, from our medical students, through our residents and our faculty. And it's actually ramping up very, very quickly, which is heartening. There are some wonderful resources out of the Global Consortium for Climate and Health Education that's based in Columbia, and also the Medical Society Consortium for Climate and Health. And we can get some of those resources later for medical educators. I and many of my colleagues are busy trying to integrate this into our medical school training, but of course, there can always be more resources. The other thing, just to add for tracking, we have the benefit of having some wonderful state and also federal agencies. And I think just as you all are doing this interagency resiliency initiative, there can be efforts at the national level. CDC has a National Center for Environmental Health. There's EPA has BenMap software. There's a lot of existing programs that can be expanded and made more robust. And right now, there's work with FEMA to potentially name heat waves, and there's work with OSHA to instill more stringent work initiatives for our vulnerable workers. So we could talk all day about this, but I'll turn it back to you, Steve.
No, I appreciate that. Every one of these questions could have been a whole class unto itself. There's such, so many layers to this discussion. And I want to thank everyone. That's the last of our formal questions. And what I'd like to do is kind of dip into the audience questions now, if I can, and ask these actually to anyone on the panel who'd like to jump in. First question from the audience: do you foresee more public-facing heat-related illness emergency instructions, something similar to educating the public on information about CPRs? How does this become accessible to everybody? And anybody on the panel, please jump in wherever you feel comfortable.
I can start there. There are some wonderful infographics that are publicly available that physicians can post in their office, from the CDC, from Lancet, that are very helpful, that begin that conversation. Certainly, I think some of the education needs to happen, within clinicians' offices, but at a public health level, I think sessions like these and getting even more information pushed out to the public will help. There's also a lot of discussions about how to integrate heat and health warning systems. And so I would be excited to see where that goes in New Jersey. I know other countries and other states are working on systems like that.
Okay, well, actually, I'm going to ask another question from the audience. What special considerations for those 60 and older should people be keeping in mind regarding extreme heat? So anybody on our panel for older adults, special considerations?
It's funny because I think that older adults often intersect with young children in terms of risk. So inability to physically manage heat is one consideration. Inability, there can be mobility challenges in being able to get to a cooling center or, get out of the hot sun. And so I think that for older adults, it's much more common than for children to be on medications, which may influence their ability to, if you're on a diuretic or some other specific medications that make you more susceptible heat, I think you have to keep it into consideration. And you also have to remember, if you don't feel good in the heat, get out of the heat. And you should never feel embarrassed to do that. You should never feel bad about speaking up or asking for somebody to help you get out of the heat.
So here's just like that, a question. Someone's asking for a friend. I'm sorry. Go ahead. Please finish that thought. Go ahead, Soko.
Oh, sorry. Oh, thank you. The other thing is that the older people tend to not take enough fluid, and usually, so they tend to get already dehydrated to start with. So that's something to keep in mind. The other thing I wanted to actually emphasize about the medications and then the heat relationship seems to be there's a emerging sort of data supporting that that's probably there. At the same time, though, I don't want people to say, oh, I have to stop this medication because it interacts with the heat. So we want people to be aware of this and then discuss with their physicians before you decide to reduce or stop medication.
So there's a few questions from the audience about meds, and I'm actually going to skip a few of those because you have talked about that in general, to ask a few other types of questions. And the next question is, what are the steps to consider when opening a cooling center, and what organizations, local governments, et cetera, are collaborating to make cooling centers a reality in New Jersey? Anybody on our group,
I want to make a comment just in general about different types of cooling centers that you may not think about as a cooling center. So during the day, there are many more options than evenings because your local library, if it's air conditioned, is a cooling center. It's not an official cooling center, but it's a cool place to be if you don't have air conditioning. The local mall may be air conditioned. So there are lots of public spaces that are available during the day. The challenge is that I don't know about your library, but my library is not open at night. And so some of the more formal cooling centers have, if they're not 24 hours a day, extended hours. So I'm going to end my comments there and pass it on to people with more specific knowledge.
I mean, we do have a network of the warming centers when it gets below, in the 30s at night. That's in effect, but it's limited and pretty much an all volunteer network, across the state. So I think it's something that agencies and organizations that deal with levels of support for different populations really need to look at. Because it's a socioeconomic issue. You could be home with no fan, no air conditioning, and you're stuck. And again, I'll just throw back to different populations that we've talked about today, but especially the elderly that are normally isolated anyway. They don't even know about these issues and these services that are out there too. So it's a really needs to be part of the framework of our public health system.
So this is kind of our final question, and it's a good wrap-up question and maybe a quick answer from each of you. The question is, and I know we touched on this to some degree, what actions can individuals take to avoid the negative health effects of extreme heat? So as a summary statement from each of you, what should people take away in terms of preparing for, in terms of thinking about what's ahead of us in terms of the climate future? Any wrap-up statements from each of you?
I would say the first step is anticipating, knowing when it's going to be hot and comparing the activities that you have planned with the heat that's out there and adjusting schedules accordingly.
Right. Other docs, other
I'll
voices?
second that. I'll second that. There are heat health action plans. We have action plans for asthma. You can do the same thing with your physician or your provider for heat. And that involves things like Soka was talking about, going through your medications. Also, having buddy systems. We know that especially for the vulnerable people, having a buddy system at a city level has really decreased the health impacts and mortality.
Bob or Soko, any final statements?
I would just say
so-
awareness and planning. I mean, you really need to be aware of how heat impacts your own body and plan for it, and be aware of what the temperatures are, and adjust your schedules and your opportunities to live.
Right, Soko.
You're
You're
muted.
on
You're on
mute
mute.
for a second.
Thank you. Anticipating the heat is really the important, but also understanding your own risks because you have chronic conditions, because you're taking certain medications, so because of your age. So all those things has to be considered, and understanding your own risk is probably another step to take.
Well, I want to thank you all so much for all of that insight today. A lot of important messages. That's all the time we have, though, for today for the discussion. So on behalf of the IAC members, state agencies, and departments, I'd like to thank all of our panelists for sharing their knowledge and their time with us today. We hope the audience walks away with a better understanding of how climate-driven extreme heat affects both our physical and psychological well-being, and why it's important for New Jersey residents to know the signs and the symptoms of heat-related illnesses, what actions they could take to protect themselves and their loved ones. As I mentioned before, the recording for this webinar will be posted shortly on the events page of Heat Hub NJ, along with the recording of the first webinar in this series. We encourage you to visit Heat Hub NJ often, as we regularly update and add new materials to the site as it becomes available. Thank you, everyone.